Thanks for the opportunity to present our paper to you today and to meet colleagues in the Pankhurst Institute. And we invited a few people from our network as well. So there'll probably be some people from the Oslo group. The paper that we're going to talk about today is Digital Public Good Platforms for Development, the Challenge of Scaling, which fits very well into the mission of this group on digital health inequalities. This is definitely well within the remit of the Health Information Systems program at the University of Oslo, of which I'm affiliated. I'm Brian Nicholson, and on the line as well is my colleague and friend Johan Saebo. And we'll begin. Just next slide, please. Just to give you an overview of what we're going to talk about, something on the conceptual framing around public goods. For those of you that are not familiar, just to give a quick primer on that, to give a frame around that, and also this notion of paradoxes for Johan to come in and talk about our empirical work, the case study that we'll be talking to you about today around the digital health information systems particular platform that we work on, and how that has been rolled out in our experiences of actually working with the public good. So we'll be talking for 30-40 minutes, and we'll have some Q&A. Johan and I don't mind at all if you want to interject, raise a hand, and we'll cover things as and when they come to your mind, or you can wait till the end if you wish. Okay, next slide, please. So first of all, a bit on our background. My staff were asked for us to just talk a little bit about where we're coming from in terms of our research training and background. I'm a professor in the Alliance Manchester Business School here in the University of Manchester. I've been here since 1999 in the Division of Accounting and Finance. I'm neither an accountant nor a finance specialist. I'm an information systems trained academic, and before that I was a practitioner. I'm also affiliated to the Centre for Digital Development run by Professor Richard Heeks in the Faculty of Humanities, and that reflects my interest both in digital transformation, ICT for development, and that's if I was to characterize myself where I am theoretically and empirically, it's in that domain. Since 2018, I've been an adjunct professor at the University of Oslo in the Health Information Systems program, which we'll be talking to you about today, the District Health Information System platform. Johan, can you just introduce yourself briefly?
Sure. My name is Johan Saebo. I'm an associate professor at the University of Oslo. Like Brian, I identify myself to be fair and square with the ICT for development community. In addition to that, I've been working in this HISP project, the Health Information System program, for close to 20 years, doing action research on development and implementation of information systems within the health sector in the global south. So we draw a lot on that project for this paper to understand these paradoxes, as this project has been supporting 1-2 countries up to being engaged in 70 countries. Thanks.
Okay, next slide, please. So there is a paper around this presentation today, which, thanks to the University of Oslo, is open access, so anyone can download this very easily. So if anything is in any way ambiguous today, you can take a look at this, which also includes the references we're going to refer to. Next slide, please. So the purpose of the paper, and indeed this project around digital public goods, is to improve our understanding around this digital public goods concept in the context of our particular interest, which is in strengthening health information systems in the Global South around the DHIS2 platform. Now, the concept of digital public goods is definitely gaining traction over the last few years. Johan mentioned that he's been working in this area for 20 years. And indeed, we were not calling it a public good at the beginning, but we've started to frame the what we do in these terms over the last 4 or 5 years. And there are a series of papers that express our interest in this. As that has gone on, we've seen a growing interest in World Bank, World Health Organization initiatives, which you can see references in the paper. There's an organization called Digital Square that's produced a digital goods guidebook, a global goods maturity model. What we wanted to do was not prove to you or sell to you the idea, but to problematize it. It's coming across as a bit of a silver bullet, the latest big thing in ICT for development. We agree there is definite, very good reason for that to be excited about. But we wanted to problematize the concept and bring our reality of implementing large-scale health surveillance, disease surveillance systems in the Global South over the last 20 years to bear on this concept, to bring some reality to it. And particularly this idea of paradoxes, that a public good that seeks to accommodate the larger global local gaps, if we put it there, and scaling to accommodate the 80 countrywide implementations that the DHIS2 has. Next slide, please. So what is a public good? For those of you that are not familiar with the literature in this area, I've somewhat simplified it to the generic. And public goods are goods that are provided because of failure of the market mechanism, in short. And the distinction between private goods is probably the best way to get your hands around the concept. So if we were to take a trip to the shops this afternoon, we'd probably encounter some traffic lights on our way to the Trafford Centre, which is a local metropolis, shopping metropolis. Now, those traffic lights, of course, we wouldn't be paying for that along the way, but when we got to the Trafford Centre, we would be engaging in the market mechanism for the goods and services that we were purchasing. But nevertheless, those public goods, the traffic lights, would be the vehicle by which we safely navigated our way to the shopping centre. And the government has intervened in that case, financially, taxation, or with licensing, to provide those traffic lights so we can safely navigate our route to the shops. So that's in essence that simple example. Next slide, please. Explains a whole series of public goods provided that you'll be very familiar with: sanitation, flood defences, crime control, vaccinations, knowledge, and public service broadcasting. Now, some of these are purer public goods than others. And of course, if you look at the notion of crime control, there is some market provision included in there, in that groups in the community can get together and buy additional security, for instance, private provision of what otherwise would be a public good. Next slide, please. So another interesting metaphor, you looked at a traffic light example, the classic case of the lighthouse as a public good. If any of you have done any sailing or even taken a ferry over to France, you'll know that there are lighthouses dotted around the coast of this country that protect mariners from the rocks and from other underwater hazards. And this generic concept illustrates quite powerfully that when at night you encounter a light as a navigator, there is this, that light, once provided, doesn't stop anybody else from seeing it, provided that the light is maintained effectively. And then if somebody benefits from that light, doesn't reduce the amount of light available to other mariners. So that, in that sense, the public good provision could not be provided by the market, because it's extremely difficult to charge. It'd probably be some way of doing it with advanced technology to monitor how much light each navigator had benefited from and charge on that basis, but it would be extremely costly and inefficient to do so. There is the free rider problem, that there is very little incentive of those that use the good to contribute to it. But the benefits are quasi-universal across groups, social groups, geographies, and generations with that example. So that is a good example of a pure public good. If we take this further into, next slide, please, into the realm of global public goods that cross borders, because some public bads do cross borders, and a good example of a public bad is the complex negotiations currently taking place in Sharm el-Sheikh to deal with who's going to pay for the tragic consequences of environmental degradation and global warming. And if you've been watching the news, you'll have seen passionate presentations from small nations like Barbados, who complain bitterly that they are suffering as a result of the global public bads. So when public goods such as a health surveillance system like DHIS2 cross borders, there are complex negotiations that need to be made. I mean, diseases don't respect national borders, so we definitely have a need for a global public good that would maintain disease surveillance, and the market mechanism, it's been shown to not be able to provide that because it requires the complex negotiation across different governments. So here we're in the realm of global public goods, particularly with disease surveillance, and we've probably never had our minds focused so much on disease surveillance than over the last 3 years. Next slide, please. So what we're focusing in on in our paper and in our presentation is the notion of global digital public goods. And here we're talking about the example there of open source software, open data, open AI models, open standards, and open content. We haven't developed the notion of the Sustainable Development Goals in this paper from that definition. That's one that we're cooking up for the future, looking at the extent to which digital public goods can contribute to the SDGs. I think probably the table one below, which we've extracted straight from the paper, summarizes what our argument is about today. So digital public goods are digital goods designed as non-rivalrous, non-excludable, locally relevant on a global scale, and displaying positive network effects. In particular, those 2 points about global and public goods, the relevance locally and on a global scale, and being non-rivalrous and non-excludable. So achieving that in practice, when we have the theoretical dimension of it, is an interesting quandary. How does that play out when there is an attempt empirically to put a digital public good into implementation? And that's what we're talking about today, is some of those tensions and paradoxes around relevance locally and globally, and being non-rivalrous and non-excludable. Just some animation directly on there, because there is an example. You just hit the down again, please, Mustafa. There we go. So there is an example besides ours of SOMAS, the Surveillance Outbreak Response Management and Analysis System, which is free of charge, open source, independent from market-based tech companies, and interoperable with other platforms. And that mirrors the DHIS2 platform. However, we have no detailed empirical data on the implementation of that, which is what we're bringing to the table with our work with DHIS2. Next slide, please. Before I hand over to Johan to provide us with the empirical background, we've one more theoretical piece of apparatus that we brought to the party in this paper, and we turn to the literature on paradox management, which comes out of the organization studies literature, to make sense of how these tensions of the implementation of a global public good were being managed, how they were playing out and how they were being managed. So what is a paradox? Contradictions that persist over time, impose and reflect back on each other and develop into seemingly irrational or absurd situations because their continuity creates situations in which options appear mutually exclusive, making choices among them difficult. So in a nutshell, that's what we're going to be talking about in this second part of the presentation today. The implementation of DHIS2 positioned as a digital global public good, and how these paradoxes play out in our experiences over 20 years of implementing it, and how those paradoxes are managed. And at this point, I'll hand over to Johan.
Thank you, Brian. Next slide, please. So I'll start saying a little bit about the methods applied in this study, and then I'll try to give an overview of the DHIS2 platform, which forms the basis for investigating these paradoxes. So we applied an interpretive case study of an open source digital platform widely used in the health sector. It is a digital global public good in that it is non-rivalrous and non-exclusive. Among the authors, we have decades of involvement, as I said, in the development and implementation of it. And maybe here I think it's worth pointing out that a lot of the work that Brian mentioned by the United Nations system, World Bank, etc., they primarily look at the production side of these. How do we make digital public goods and make them available? But we also look at their implementation and the consumption side, and often the blurred lines between these two. We focus on 3 vignettes highlighting different paradoxes. So that's what I will visit now. So next slide, please. First, a bit about the DHIS2 platform. So this is just a map showing the current use of the DHIS2 software as a national health management information system. This means that the countries here in green, to various extent, the dark green, have this as a national system for handling aggregate health statistics for routine management, for policy making, for resource allocation, etc. And it started, the predecessor of DHIS2 started in South Africa in the mid-90s, and with a few more countries implementing it in the early 2000s. We've seen a rapid scaling up since 2010, where online, phone-based internet, mobile internet, was widely available in a lot of these countries. That really allowed countries to use this as the server-based system. So the last 10, 12 years, we've seen a massive scale increase up to around 70 countries, several big Indian states, some also very populous countries like Bangladesh, Nigeria, Indonesia. Next slide, please. So very, very brief overview of the software technology itself. I'll start on the top left corner here. The platform is very flexible, which forms part of the paradoxes later. It is kind of an empty toolbox to customize your information system. So set up the kind of data you want to collect, how that should be processed and analyzed and shared, etc. So on the top left is a typical screenshot from what 90%, 95% of users will see. This is from our demo on Sierra Leone, showing that every month they have, for the different clinics around the country, they report on the services provided. So this just shows the vaccination figures, BCG doses given, etc., for routine data collection. Then moving on to the right, also flexibility to define how you combine different pieces of data to calculate indicators that you use for decision making. In this case, BCG coverage, and you have full authority as admin user to create whatever you want here, which indicators you would like to see. This then allows you to create various types of visualizations. There's support there for charts, tables, maps, etc. And also on the bottom left side to combine different visualizations into dashboards. Typically then dashboards organized for different health programs. So a malaria coordinator in a district or a province or at the national level will have a dashboard showing the most important indicators in various ways, various visualizations. Based on changing and emerging needs, you can make them changes over time. And implementing countries do this themselves, so should do that. We provide the software, we have a lot of training opportunities, we collaborate with many groups, but the countries should own this and they should be able to customize this and make the systems they need. Next slide, please. Yeah, you can go one more click at the button. So DHIS2 fits well this criteria of public good. It's non-rivalrous and non-excludable. You can download it freely. If you do that, it will not reduce the possibility for others to do it. It's also globally available, and in our definition that Brian just showed, we also include the aspect of being relevant. So for us, it's not necessarily that interesting that it's non-excludable and non-rivalrous. It should also be relevant or be able to be made relevant to different contexts. And that brings us to the platform architecture, which has been a response to this, allowing local innovation on top of the platform as third-party apps, for instance. So from this definition, we think that DHIS2 is a good example of digital public good. Next, please. Yeah, here I'm just showing where you can, how you can get your hands on the platform. You can freely download it online. This also has its app hub where you can download apps. You can also nominate if you make your own apps to have them on this app hub, just like Android or your iPhone would have. Next, please. So I'll take you straight to the conclusion in a way. We identify 3 paradoxes, and the commonality between them is that scaling dynamics plays out differently at the macro and micro level, the global and country level. So that's the key of these 3 paradoxes, that the scaling mechanisms and dynamics at global and country level are sometimes in opposition. They create challenges regarding attaining this non-rivalry and non-exclusion. If we implement something that promotes more global scaling, it may make it harder to attain the characteristics of a public good at a local level. So then I'll go into these 3 paradoxes. If you go to the next slide, please. And we cover more of this in the papers. I'm not going to provide screenshots and lengthy descriptions here. But the first paradox we found was that of using sophisticated tools for relatively simple analysis. So at the global level, we keep adding more functionality to cater an increasingly diverse user base. Some of those users are more expert. They would need more expert tools, sophisticated tools, while the bulk of the users still need only relatively simple stuff. And this is kind of a paradox here, in that we try to accommodate the different users which are working in ministries of health, public servants across the globe, who have different needs. As the software is taken to new contexts, there will be slightly new ways of doing things, even though the use cases are typically similar. Sometimes there's a very new need emerging. It can be because DHIS is used in a new domain, in education, for instance. What we see of this paradox is that trying to accommodate the more expert users with sophisticated tools, then we risk alienating the users who only need more simple tools. The navigation in the software itself, the kind of knowledge you need to make the right selections, for instance, in your analysis, will be much greater. So the paradox here is the balance or the kind of contradicting needs by different user groups, and how to serve both needs. Next, please. The second paradox we cover in the paper is about prioritizing voices that tend to be unheard. So DHIS2 is an open source platform. It's primarily developed by software developers in Oslo, some around the world. With a platform architecture, the platform core is developed here in Oslo. We serve tens of thousands of health workers across the world. It's not always easy for them to reach us and to be able to articulate what they need. It's quite, you need some connections, you need knowledge of the system, you need to formulate this in a way that we can interpret to put it into the roadmap. These are, particularly the people we need to reach. These tens of thousands of health workers at, district level in Bangladesh or somewhere else. But it's very hard for them to reach us. Those who have, find it much easier to reach us are larger international NGOs, for instance. A couple here, UNICEF and NORAD, and many of them have been very good, like NORAD, in supporting the development this as a public goods with very few strings attached. NORAD, the Norwegian Agency for Development Cooperation, don't tell us what to do, what kind of features to include in the roadmap. They give us, core funding. But there are other international NGOs, and there are, all kinds of actors in between the end user in some office in the rural area somewhere and someone sitting with direct access here in Oslo. We found it is very, very hard to give priority to voices that we don't even may be aware of. How can we prioritize those users that may not be able to communicate with us at all, that we don't necessarily know that they exist or what they need? Next, thank you. Yes, the last paradox is maybe also related to the first one, of building software simultaneously relevant for global and local context. So this is deep down a tension between generic features and particular needs. So following our own definition and our aim of making DHIS2 relevant locally on a global scale, we will have to make the software generic. It will have to be possible to disembed it from a particular context, make it generic so that it can fit the most users. That, of course, increased the amount of work, the amount of skills, the tinkering, the bricolage of making it more locally relevant again. And you know, it needs to be deeply embedded in an organization to fit the needs of that organization. And this paradox of you know, increasingly cater to a larger user base, which leads to more and more generic solutions, at the same time as you try to make these solutions that should be locally relevant. That is kind of the key key challenge for the developers, to make something generic that is also locally relevant. So there's this increasing gap between the global and the local. So the very quick and dirty presentation of 3 paradoxes here. If you go to the next and I think last slide, second last, we also cover a bit about how we have addressed these paradoxes. We don't just identify them and describe them. We also look a bit on how we have addressed the paradoxes as they have become more prominent over time. And a lot of this is about decentralization and building south-south networks. So I put here a lot of the logos of different HISP groups, which are affiliated groups with the University of Oslo, not-for-profit organizations, sometimes aligned with universities, who develop local capacity and help ministries to resolve these tensions that the paradoxes give rise to help close the local global gaps. Our paper don't deal that much in depth about this, but we do say a bit about how the Health Information System program as an overall network has tried to deal with the paradoxes. Next slide, please. And this is the last one, and I'm happy to discuss this further. We were asked to try to link this to health equity. And my point of departure here is maybe, you know, the focus on the global digital public good. That if you look at it from a global perspective, we provide a free open source public good for countries to use. So not looking at individuals per now, but what we do is to provide this digital public good for national ministries to build whatever systems they want. So you know, when using this metaphor of a tide, this is really what we aim to do, to provide a tide that can lift all boats. But of course, that comes with these paradoxes of trying to serve many, leading to very generic or complex solutions that may lead to scaling challenges at the national level. You may alienate users who want something simple. You may raise the bar too high for embedding the system in an organization when there's so much that needs to be done to customize it, etc. Not sure if you want to add something to this very last point, Brian.
Yeah, it's where we brought in the theory around public goods, that collective action and subsidiarity points that the previous slide alluded to, the mechanisms by which these smaller groups can come together for collective action is one solution towards that problem of overcoming the paradoxes. And subsidiarity, again, from the theory around public goods, that subsidiarity allows levels in the hierarchy that can be created, once again, to allow even down to community action, to allow a voice to be heard. So the theory offers some solutions that that have been put into practice in the Oslo team, and also as it's been rolled out into each of the locations. It's worth remembering that each location is separate. This is not like Facebook. It's not one single centralized platform. Each implementation in each country is managed separately and is a distinct implementation.
Thanks, Brian. I think that concludes our presentation.
Yeah. Thank you.